Every 13 seconds, someone dies from pneumonia in the world. Every 18 seconds, we lose an adult to pneumonia. And every 47 seconds, we lose a child less than 5 years of age. Pneumonia kills more people than any other infectious disease in the world, 2.5 million in 2019 alone. And this doesn't even include pneumonia deaths from COVID-19. Pneumonia is an infection of the lungs that causes inflammation, making it difficult to breathe. Pneumonia can present as an asymptomatic infection, a relatively mild localized disease, or a fulminant systemic disease with respiratory failure and multi-organ dysfunction. Pneumonia is caused by a variety of microorganisms, of which bacteria and respiratory viruses are the most common. Respiratory syncytial virus, Streptococcus pneumoniae or pneumococcus, coronavirus, influenza virus, rhinovirus, metapneumovirus, Haemophilus influenzae, Klebsiella pneumoniae, and Staphylococcus aureus can all cause pneumonia. Pneumonia can be categorized by how it is acquired. The most common is community-acquired pneumonia, when a person gets ill outside of a hospital or a healthcare setting. Then there is hospital-acquired pneumonia or nosocomial pneumonia, when a hospitalized person gets pneumonia. Nosocomial pneumonia is associated with higher mortality because it is often caused by antibiotic-resistant microorganisms that are harder to treat. Anyone can get pneumonia. People with weak immune systems are especially at risk. This includes children under 5, adults over 70, people with chronic diseases such as COPD, diabetes, and chronic cardiovascular disease. Across all ages, air pollution is the #1 risk factor for pneumonia death, contributing to 30% of all deaths. Both household air pollution from cooking and heating with solid fuels and outdoor air pollution are major risks. In children under 5, wasting, low birth weight, and preterm birth are also major risks for pneumonia death. Pneumonia can be detected by symptoms like shortness of breath, chest pain, productive cough, fever, sweating and shaking chills, fatigue and confusion, especially in older people. Pneumonia can be prevented. The most effective way to prevent pneumonia is through vaccination. 1 in every 2 children has not received the pneumococcal conjugate vaccine. But vaccines do not prevent all causes of pneumonia, and it is vital that people with pneumonia symptoms seek health care quickly to get diagnosed and treated with antibiotics and oxygen if needed. But almost 1 in 3 children with pneumonia symptoms are not taken for care. Pneumonia not only affects the lungs, but it can also cause sepsis, acute respiratory distress syndrome, pleural effusion, and cardiac complications, especially in the case of pneumococcal pneumonia. Untreated pneumonia can kill in 48 hours. Early treatment of pneumonia saves lives. Pneumonia is the world's biggest infectious killer of adults and children, claiming the lives of 2.5 million, including 672,000 children in 2019. Every country is affected. 3/4 of all pneumonia deaths occur in 20 countries spread across Asia, Africa, the Americas, and Europe. Adult pneumonia deaths are concentrated in Europe, Asia, and the Americas. Child pneumonia deaths are concentrated in Africa and Asia. 5 countries account for half of all pneumonia deaths in children under 5: Nigeria, India, Pakistan, Ethiopia, and Niger. You can help educate the world about pneumonia. Share this video on your social media using #Pneumolight and #EveryBreathCounts. Tell your friends and family about pneumonia and participate in World Pneumonia Day on November 12th every year. While you're watching this video, 15 adults and 5 children will die from pneumonia. But we have the tools to prevent most of these deaths. The more people know about pneumonia, the safer everyone will be. Stop pneumonia. Save lives. For a better world, a new world. Pneumolight.